The cost of healthcare really is escalating pretty dramatically.
People can't afford insurance. They just simply cannot afford it. And we're not talking about just, lower income people. We're talking about, people who make good, significant incomes today, above average incomes, cannot afford health care.
The last 3 years have seen double-digit inflation in health costs.
Have your health care expenses gone up in the last 5 years?
We know the answer for almost any of us that are paying for it is that it's doubled or tripled.
Have your deductibles increased? Have your co-pays increased?
We had a kid go in for a routine appendectomy at a major West Coast hospital. In less than 24 hours, the bills were just over $49,000.
Or has your coverage gone away?
We had Blue Cross Blue Shield in California. When we moved back here, they wouldn't take Ron because his cholesterol level was too high. I mean, even though we could afford it, we couldn't get it.
Bad news, it's going to get worse.
There are about 40 million people in the country who have no insurance at all.
And when costs go up, and they will, the result will be catastrophic.
A lot of our elderly are trying to decide if they're going to eat or get a prescription filled.
The solution? There hasn't been one, but that is about to change. AmeriPlan Health, the future of healthcare.
It is a profound change in healthcare delivery.
A solution that is not insurance. It's the perfect alternative. No deductibles, no claim forms, no hassles. It's being called CDHC, or Consumer-Driven Healthcare, and it is changing the way people get the care they need.
It is a tremendous shift. The advantage of that is they can choose how they use their healthcare dollars. It's just, what do you need? And let's pay for what you need and not pay for what you don't need.
Finally, a solution for the millions of uninsured and underinsured people in North America.
What AmeriPlan is able to provide is access to health care when and if they need it. And, what value is that kind of security? It's an unquestionable value.
Here's how it works. Instead of paying high annual premiums and then paying co-pays and trying to meet deductibles, AmeriPlan Health members simply pay their doctors at the time of care. And here's the good news. Those rates at the doctor's office are dramatically lower than the doctor's usual and customary fees.
It's a win-win situation.
Every AmeriPlan Health member will be issued an AmeriPlan Health credit card. This card can only be used at an AmeriPlan Health network provider for healthcare expenses. At the point of care, the member will be asked how they want to pay: cash, check, personal credit card, or AmeriPlan Health credit card. This is unique to AmeriPlan Health.
So this is truly a new and different way to look at things. And it's simply eliminating what doesn't provide value in the healthcare market.
Have you ever been denied service because your insurance company says you have a pre-existing condition? Not a problem with AmeriPlan Health, because all pre-existing conditions